Presiding Officer, for the first time ever, nurses who work tirelessly in Scotland's NHS have voted to go on strike. It's not only about pay. They are incredibly worried about the crisis in Scotland's health service. This morning, Hilary Nelson from the Royal College of Nurses had this grave warning when she said, "Things are not safe for patients." Deputy First Minister, what has the Health Secretary Hamza Yousaf done to address the concerns from nurses about staff shortages and patient safety?
Deputy First Minister.
Presiding Officer, before I address the question from Mr Ross, I should explain that the First Minister is meeting with the Prime Minister today in advance of the British Irish Council, and she's asked me to answer questions on her behalf. Let me associate myself entirely with Mr Ross's remarks in relation to the moment of remembrance over the weekend. We will all fall silent on Sunday. Tomorrow, in my own constituency in the city of Perth, there will be a remembrance event that I will attend at 11 o'clock to mark the sacrifice of individuals throughout all conflict. And as we speak, my Cabinet colleague Keith Brown, who is himself a distinguished veteran, is in the Falklands on the 40th anniversary of his active service in the Falkland Islands conflict. We remember the suffering of individuals, the sacrifices of their families and their loved ones, and we pay tribute to those who continue to endure that suffering today for the injuries that they have suffered and the experiences that they have had. Presiding Officer, there are many challenges in our health service, and I recognise the concerns that are expressed by members of staff through the ballots that have taken place. There have been extensive negotiations that the Health Secretary and I have also been involved in to try to resolve the pay deal, the pay issues, and we have put forward a record pay deal which on average will offer members of staff a 7% increase for those in the lowest of incomes, an 11% increase, recognising the enormous contribution that is made to our society by health service staff, and recognising the enormous cost of living pressures that are being wrestled with by members of staff. In addition to that contribution to resolve those issues, the Health Secretary has been actively involved in discussions to address some of the challenges within our health service, principally around about the issue of delayed discharge, which we recognise to be one of the most significant factors in impeding the flow of patients through accident and emergency and to other aspects of the health service, and then, ideally, to ensure that those individuals are then supported appropriately within the community. There are, of course, challenges about the availability of members of staff to do that. We have record employment within the health service just now, but we also have vacancies, and we have vacancies within social care, which of course has not been helped by the fact that we have lost free movement of citizens, which was helping us to deal with the issues that Mr Ross raises. So I assure Mr Ross that on all issues, the Government is entirely focused, with very clear direction from the Health Secretary and with the active support of the First Minister and myself, to make sure that we address the challenges that we face.
Douglas Ross.
So that's the SNP defence for what they're doing. Let's hear from nurses themselves. Dawn Marr from the Royal College of Nurses said this last night: "We've been in talks for months and months and months, and it has got to the point now where nursing staff are having to stand up, not only for ourselves, but for our patients as well, because this government is not listening." And it's now beyond doubt that this Health Secretary has failed. Dr Peel, Chair of BMA Scotland's Junior Doctors Committee, said this week, "Right now, it's been so awful for so long, we are simply broken, overwhelmed, exhausted, with nothing left to give. As far as I can see, the NHS is collapsing around us. Staff are leaving in their droves to protect themselves. And the facts confirm that our NHS is on its knees. This week's statistics revealed the situation at accident and emergency departments is at its worst ever levels. More patients are waiting longer than ever before. Now, this is a new low, but it's the 14th time since Humza Yousaf became Health Secretary that waiting times have hit their worst ever levels. Every time we think it can't get any worse under his leadership in the NHS, it does. So, Deputy First Minister, surely you agree this is a damning indictment of the Health Secretary's time in charge of Scotland's NHS?
Always through the chair, please. Deputy First Minister.
Presiding Officer, what I accept is that there are very significant challenges in the National Health Service. There are very significant challenges in the National Health Service right across the United Kingdom. So the point that Mr Ross makes about accident and emergency is an important point, but it has to be considered in its proper context. In its proper context, although there are challenges in A&E in Scotland, we have the best performing A&E system in the United Kingdom. On the question of do governments listen, yes, this government listens. That's why we've offered health service staff in Scotland the best pay deal of any system in the United Kingdom. And on the question of the future of the National Health Service, resources are absolutely fundamental. That's why it is laughable for Douglas Ross to come here and raise these issues with me when only 7 weeks ago he wanted me to cut tax in the folly taken forward by Liz Truss, which would have damaged public investment in our health service.
Douglas Ross.
John Swinney. John Swinney.
Thank you.
John Swinney wants to consider the statistics and the facts in the round, so let's make sure he is speaking about the correct figures, because we know there are reports from a whistleblower this week that as many as 2,000 patients per month are being missed off of A&E waiting times in just one hospital in Scotland. So if you're going to come to this chamber and quote figures, make sure they are the correct figures, because, Deputy First Minister, this is the most serious of issues. Lives are on the line because this Health Secretary keeps failing to bring forward any solution. We've spoken to one lady this week who called an ambulance when she had a suspected heart attack. They waited for an hour for the ambulance to arrive. When it then got to hospital, they waited outside the hospital for 3 hours. When they got inside, they waited 36 hours to get a bed. Now, the lady involved and her family are full of praise for the staff, but this is clear. It was a suspected heart attack, and a tragedy has been avoided in this case. And I know every single MSP in this chamber, including those who clapped the Deputy First Minister's response there, has cases like this coming from their area. Yet this morning, the Health Secretary, Humza Yousaf, said, and this is a direct quote, "Our recovery plan is a 5-year recovery plan. We are already seeing elements of recovery." Elements of recovery. What planet is he on? So, Deputy First Minister, can you tell this chamber, can you tell patients, can you tell staff in our NHS, what are these elements of recovery within the NHS?
Can I remind members that to speak through the chair, please? Deputy First Minister.
Thank you, Presiding Officer. In relation to the circumstances that Mr Ross recounts, of course it is of the deepest of concern that a member of the public has had to wait that long for the degree of access to an ambulance and accident emergency. I would say to Mr Ross, the median time for the arrival of ambulances is of the order of 45 minutes. So the circumstances that he has recounted are unacceptable. There is congestion in our A&E departments, which is caused by the volume of presentations at A&E and also because of the obstacle created by the number of patients who are in hospital that should be discharged. And that is a focal point of significant activity across government to ensure that we reduce delayed discharges. Indeed, the Health Secretary and I spent a significant amount of our time yesterday in discussion with partners about practical steps to address that. In relation to the question of improvements in the National Health Service, the Government has invested £600 million in the Winter Resilience Support Package. We are helping to recruit 1,000 members of health and care staff to support staff in their activities, and we are investing £50 million in urgent and unscheduled care to help to improve A&E performance. In terms of the progress that has been made, Mr Ross should be familiar with the fact that the longer waits for treatment are reducing significantly in relation to the 2-year position, which was one of the priorities set by the Health Secretary. So I accept there are challenges in the National Health Service, but I take this opportunity to pay tribute to the members of staff who are working phenomenally hard on the back of a pandemic that Mr Ross never acknowledged in its significance.
Deputy First Minister, can I ask members to remember that the Code of Conduct requires that we treat one another with courtesy and respect, and that means that we hear one another when we are speaking. Deputy First Minister.
Thank you, Presiding Officer. So I pay tribute to members of staff who are working phenomenally hard on the back of a pandemic which Mr Ross never mentioned, which has put huge strain on our National Health Service, but they are doing their level best with the largest number of staff ever provided in the National Health Service by this government to support the people of our country.
Douglas Ross.
I will always praise our NHS staff. I highlighted the case study that I used as an example where the family rightly praised our NHS staff. But John Swinney, like his boss, is using COVID as a deflection for his government's failures because Karen Morrison from Forth Valley Unison, the Secretary of Unison for Forth Valley, described the situation at Forth Valley Royal Hospital as far worse than we had in the pandemic, 1,000,000 times worse. So stop using that as an excuse for your failures and start dealing with things. Because
through the chair,
from
please.
day one, Presiding Officer, we have said to John Swinney, the SNP and this government that Humza Yousaf's recovery plan was hopeless. It was flimsy, no detail and no substance. The SNP insisted it would get Scotland's NHS back on track. But this is what their recovery plan has delivered. Record vacancies, the longest ever waiting times, patients struggling to see their GP, nurses voting to strike for the first time ever, and the worst A&E waiting time statistics on record. Scotland's NHS is in crisis. And whoever the SNP try to blame, it's obvious that the man responsible is sitting right there next to the Deputy First Minister. Humza Yousaf has failed, and all he can do is spin that the SNP is in recovery when really it's at breaking point. Just how much worse does it have to get for patients and staff in Scotland before he takes responsibility? Deputy First Minister, Scotland's NHS deserves better than Humza Yousaf. When will this Health Secretary be sacked?
Deputy First Minister.
Given the absolutely, totally chaotic turmoil of ministerial resignations and dismissals in the United Kingdom government, what a laughable proposition to put to me this morning. I've been active in politics for many years, a Member of Parliament for a quarter of a century, and you know when somebody's run out of road when they start playing the man and not the issue, which is what Douglas Ross is doing just now.
Thank you.
Yes, there are challenges in the National Health Service. Yes, there are challenges. But there's a record pay deal on offer from the Scottish Government.
Deputy First Minister. I'm being gesticulated at across the chamber. Members are shouting. I would be grateful if we could remember that as parliamentarians we have a duty, and a duty too, to adhere to a code of conduct. And that requires that we treat one another with courtesy and respect. And I would ask all members to please remember that at all times. Deputy First Minister.
Let me just tell Douglas Ross the situation that we are facing and we're experiencing. We have the best pay deal on offer in the United Kingdom to health and care staff. We have record A&E performance, the best record performance of any health system in the United Kingdom. We have record numbers of staff in the National Health Service. And when I tell them what's not helping is the folly of Brexit, because Brexit has reduced the amount of staff available because of the loss of free movement. And I'll tell Douglas Ross what's also not helping. It's the fact that the United Kingdom government is not recognising the public spending pressures that exist because of inflation that they have fuelled by their stupid economic decisions, and as a consequence, public budgets are under enormous pressure. So if Douglas Ross wants to make himself useful, he can ask the United Kingdom Government to increase the budget for the Scottish Government so we can support the health service to a greater extent and start addressing the issues that face members of the public.
Question number 2.